Healthcare linen and garments are essential resources for patient care. They are used to clean patients, keep them warm, prevent infection, and provide them with comfort during times of treatment, procedures, and illness. Healthcare linen and garments are also used to protect healthcare workers. Garments, scrubs, and gowns, when properly worn, provide a protective layer of linen to reduce the risk of microbiological transmission. The crucial need of healthcare textiles and worker protection, and patient treatment demands that all healthcare workers handle clean textiles with care. The purpose of this video is to provide you with an overview of the healthcare industry's best practices for the handling and usage of clean healthcare textiles. Following these practices will help prevent injury, reduce the risk of contamination and infection, reduce the misuse and abuse of linen, especially linen loss, and promote a culture of care and stewardship in your organization while improving overall patient satisfaction. This video was produced by TRSA, the Association for Linen, Uniform and Facility Services, and its global alliance of member companies who are certified on TRSA's Hygienically Clean program to ensure the highest standards for clean textiles in healthcare facilities. TRSA and its members want to work with you to ensure the safety of all healthcare providers and personnel, and to reduce the expense of lost linen products. To accomplish this goal, TRSA has developed several easy-to-implement steps that follow industry best practices for using and handling clean linen. These steps are called the 6 C's of handling clean healthcare linen. They include count, control, circulate, care, clean, and cooperate. Following these steps will help healthcare workers and facility staff use their linen more effectively for patient care. Let's take a more detailed look at each of the C's and what specific steps you should follow when handling clean healthcare linen. Count. It is essential to account for the linen you have received from your healthcare linen provider to ensure linen is available for patient care. Upon delivery, facility staff responsible for receiving linen must ensure the invoices match the type and quantity of items in your delivery. Since linen is typically assembled in bundles or carts of specific quantities, it is not necessary to count every single item. However, a close enough check should be performed to ensure the proper item types and quantities have been delivered. Knowing the different linen items and bundle sizes as well as how to read the delivery invoice will help you match your physical inventory against the paperwork. Next, staff responsible for bringing clean linen to patient areas must ensure that they take the correct count of linen items to the designated points at the correct times. This process entails working with leadership in patient departments to determine accurate linen quantities and restocking times. Lastly, healthcare workers who use the linen to care for patients must be aware of how to identify and report shortages and adjustments. Following these best practices is essential to maintaining a proper count of linen for use in patient care. Control. Clean linen should be consolidated in designated holding areas with controlled access. All healthcare practitioners responsible for handling clean linen should be aware of the locations of these holding areas. Hallways are not preferred holding areas due to their high traffic. The more people who can access the linen, the greater the risk of contamination and linen loss. If hallways must be used due to space challenges, then ensure all personnel who access the linen are properly trained. Do not stash emergency linen in hidden areas. Though that linen may seem to be secured, if it's not placed in a designated and controlled area, then it will not be properly maintained for use in patient care. Linen should be covered or contained unless it is actively in use. The goal of facilities should be to maintain controlled access to the linen, where designated and trained individuals are the only personnel who are allowed access. The use of computer-based inventory systems will help ensure a greater level of control of linen supply and usage. For garments such as scrubs, dispensing machines provide facilities with greater means to manage usage levels. Ensure only applicable healthcare personnel who need or handle scrubs have access to the machines and know how to use them. It is important to note that once linen is placed and stored in a patient room, that linen is treated as soiled linen when the patient is discharged, whether or not the linen has been used for any reason. Storing linen in a designated holding area and controlling access is the safest, cleanest, and most cost-effective clean linen practice. Circulate. Linen located in designated holding areas should be continually rotated and refreshed. The principle of FIFO, or first in, first out, will help reduce the risk of contamination caused by dust and dirt buildup. Linen should be taken from the top and front of shelves for use. When restocking linens, new items should be placed either underneath or behind linen already on the shelves. Also, an inventory control system can facilitate the circulation of linen by maintaining accurate on-hand quantities and keeping par levels up to date. Care. Preserving the quality of healthcare linen presents a significant cost to the day-to-day operation of healthcare facilities. Healthcare providers must care for linen to ensure it remains a safe and available resource for the treatment of patients. Linen should never be torn, altered, or damaged, and it should never be used for any non-patient care purpose, such as cleaning spills and propping open doors. It should also never be given away to patients or visitors. Be mindful of your linen usage and ensure you follow your facility's linen usage and handling policy. Some key best practices to keep in mind include the following. Underpads. One correctly placed reusable underpad is sufficient in most cases and may also be used for repositioning a patient. Blankets. For patients who are cold, provide them with a second flat sheet before using a second blanket. A second sheet can often enhance warmth and meet your patient's needs. Placement. Linen should always be kept in its proper place. Clean linen should be stored in designated areas with controlled access. Soiled linen should always be placed in designated bags in the soiled linen hamper. Do not throw away linen, and do not place linen in red bag waste. Clean. Healthcare linen is thoroughly washed and decontaminated using water, chemicals, enzymes, and heat. Once linen is cleaned, it is placed in sanitized carts and covered to prevent contamination in transit to and at the customer location. Healthcare professionals should make the same effort to keep linen clean at their facilities until patient use. Ensure the designated linen holding areas conform to guidelines and regulations from certifying authorities, facility leadership, and government agencies. Linen holding areas and facility carts should also be cleaned on regularly scheduled intervals. Logs tracking the dates of cleanings should be kept at or near the areas. Linen shelves and carts should also be positioned in a way that facilitates proper cleaning. Be sure to check with infection prevention and facility policy for proper placement procedures. Note that the bottoms of linen shelves should be solid or have plastic barriers to prevent dust and dirt from the floor from touching the linen. When moving linen throughout a facility, cart covers should be used to protect the linen. These covers should also be routinely cleaned and sanitized, and linen should not be placed on top of them. Clean also applies to hand hygiene. Prior to handling clean linen, you must ensure your hands are clean in accordance with your facility's hand hygiene policy. It is crucial for healthcare workers, linen attendants, EVS personnel, and any other facility staff charged with handling clean linen to practice hand hygiene in order to prevent cross-contamination. Following hand hygiene best practices, as well as the other clean procedures, will help improve quality of care and ensure patients receive the cleanest linen possible. Cooperate. Finally, Managing clean linen in a healthcare environment requires cooperation. Work with your linen service provider to ensure that clean linen is correctly accounted for and properly handled in your facility. Environmental services personnel, housekeeping, healthcare workers, and facility administration and management must communicate and cooperate as a team to identify and implement best practices in your specific facility. This cooperation will help create a clean and safe facility, complete with clean linen, and that will lead to improved patient satisfaction. As a healthcare worker in a hospital, nursing home, or other healthcare facility, you probably handle linen every day. Keeping this linen clean before it is used with patients is critical to reduce the spread of infection, improve quality of treatment, and increase overall patient satisfaction. TRSA and its associated healthcare linen providers are committed to producing hygienically clean linen for your facility. TRSA's Hygienically Clean program certifies laundry operations on best management practices, quality assurance, and cleanliness through third-party inspections and testing. Following the 6 C's of handling clean healthcare linen: count, control, circulate, care, clean, and cooperate, will help you ensure linen stays hygienically clean in your facility and will help improve patient care and reduce costs. It is up to you to understand, know, and follow these 6 C's in your day-to-day work. For more information on TRSA's Hygienically Clean program and how it can ensure the highest standards for clean textiles in your healthcare facility, please visit hygienicallyclean.org. On behalf of TRSA and all of our associated healthcare linen providers, we thank you for watching and look forward to being safer and hygienically clean together.